Today we're going to do the physical assessment. So I've knocked on the door and the patient has allowed me in. I'm going to wash my hands with soap before starting my examination. So we have Mrs. Jackson here. She's arriving here as a new patient, so we're going to do her first exam. The first thing I'm going to start with is to measure her blood pressure. All right, Miss Jackson, so the first thing I'm going to do, my name's Lisa, I'm the nurse practitioner, so I'm going to get your blood pressure. Okay, so the blood pressure is 122/70. Okay, and now I'm going to monitor your pulse. I'm going to get a radial pulse. Okay. And for this, you'll want to count at least 30 seconds, if not for the full minute. Okay, Miss Jackson's pulse is 64, so now we're just going to monitor respirations. And again, you want to do at least the full 30 seconds or the full minute. And while you're checking the respirations, at this time you can also see that the shoulders are level. You can kind of get a good look at her face. Respirations are 16. So the next thing I'm going to examine is going to be the skull, hair, and the scalp on Miss Jackson. Okay. So first I'm going to inspect the skull for general size, shape, and contour. And you could kind of just tell by looking at it visually. I don't see any knots, any bumps. And her head and her skull looks like it's even anatomy. The hair texture, her hair looks like it's moist. It doesn't look really dry or brittle, which could be signs of bad health. She looks like she's hydrated. Hair texture and quality are good. Examine the scalp for any skin lesions. So you would just do like a brief view of the scalp. I don't see any lesions or any open areas to her scalp. Okay, if you could bend your head slightly forward. Okay, and then you're just going to part the hair in several places with the fingers. You're going to note any scaliness, lumps, or any other skin lesions, which we've already done that. This patient does not have any of those. Okay, next thing you're going to do is palpate the scalp. I'm going to feel the front to back with short sweeping motions, looking for lumps or tender areas. Is there any tenderness with me doing this?
No.
Okay, and I did not feel any lumps or any dry areas. So the next thing I'm going to check is going to be the frontal sinus bilaterally. To do this, you're going to palpate for tenderness above each eye. Okay, around here. Do you feel any tenderness there?
Mm-mm.
Okay. So that's negative for any tenderness. That's the frontal sinuses. And then next I'm going to check the maxillary sinuses bilaterally. To do this, you're just going to palpate below each eye. Okay. there any pain when I do that?
No.
Any, not tender anywhere?
No.
Okay. So both sinuses are negative for any tenderness or pain. Alright, so the next thing I'm going to check is going to be the lymph nodes and the thyroid. First I'm going to start with the preauricle nodes bilaterally, which are here right in front of the ears. So you're just going to check that. Any pain or tenderness with that?
No.
Okay. The next thing you're going to check is the posterior auricular nodes bilaterally, and those are just right behind the ears. Right about there. You're just going to palpate that. Any pain or tenderness with that?
No.
And the next thing you're going to check is going to be the occipital nodes bilaterally, which are there at the base of the skull. Any pain or tenderness?
No, ma'am.
Okay, and the next thing you're going to check is going to be the anterior cervical nodes bilaterally. To do this, you're going to palpate the anterior over the sternocleidomastoid muscle throughout its whole length. Okay? Now this. And you're going to want to go down the whole muscle. Okay. And 3 areas were palpated. Any pain or tenderness with that?
No.
Okay, next I'm going to check the posterior cervical nodes bilaterally. To do this, you're just going to palpate the posterior to and under the sternocleidomastoid muscle. Okay, so this is going to be behind here. Okay, it's posterior cervical nodes. Any pain or tenderness with that?
No.
Okay, the next thing I'm going to assess is going to be the supraclavicular nodes bilaterally. To do this, you're just going to palpate above the collarbone. Okay, and you want to do this on skin, so she does have her shirt off. It's just for video sake. Obviously, we'll keep it on. Okay. Any pain or tenderness with that?
No.
Okay, the next thing we're going to test is going to be the tonsillar lymph nodes bilaterally, and that'll be just at the angle of the jaw. Okay, any pain or tenderness with that?
No.
The next thing is going to be the submandibular lymph nodes bilaterally. It's going to be between the tonsillar and the submental nodes. So prior to palpating the thyroid, you want to observe the thyroid gland by asking the patient to swallow. Can you go ahead and lift your head just a little and swallow for me? Okay, and you're able to see the thyroid like that. Okay. And then first, you're going to want to watch her swallow, and then you want to feel while she swallows. So go ahead and swallow for me again. Okay. So that one was good, and then the next thing we're going to check is going to be the eyes. Test visual acuity, bilateral and separate with a pocket visual screening. I'm going to have a chart here that I'm going to hold 14 inches from the patient's face. The patient does not wear any glasses. Okay. To test the visual acuity, you're going to stand approximately 12 inches from the patient. The patient's going to close her right eye, and then the examiner is going to cover their left eye. So to do this, I'm going to extend my right arm. Okay, if they can see me. Okay. Okay. Can you see my hands or fingers right here with your right eye shut?
Yes.
Okay. So I'm going to wiggle my fingers and bring it in, and you tell me when you can see it, okay?
Okay. I can see it.
Okay. So with the patient's right eye still closed and my left eye still closed, extend my left arm. Repeat what's done in that step. Wiggle my fingers. So, are you able to see my hand down there with your
No.
eyes shut? No?
No.
Okay, so I'm gonna wiggle my fingers and you tell me when you can begin to see it.
Now.
Okay? And now we're gonna have you close the other eye and we're gonna do the same thing. Okay?
Okay.
Can you see my fingers?
Yes.
Okay. So, I'm gonna, pardon me, start wiggling and you tell me when you are able to see them.
Now.
Okay. And then you're gonna do the same thing with your other hand. Okay, you able to see it?
No.
Okay. I'm gonna wiggle and you tell me when you can see it. Okay?
Now.
Okay. I'm gonna check for convergence. Gonna hold my finger in front of the patient's face, moving the finger toward the patient's nose. Okay. Okay. 1, 2. Okay. Okay, now we're gonna test cranial nerves 3, 4, and 5, asking the patient to hold the head completely still and follow my finger, looking rightward and leftward, up and out and in, down and out, to the extreme of the gaze. Okay, so you're gonna follow my finger. Okay. The next thing we're gonna do is test the cranial nerve 7 motor function. I'm gonna ask the patient to close her eyes. And I'm gonna try to force the eyelid open. Okay? So try to keep it closed against resistance. Okay. Same thing with this eye. You're gonna try to keep it closed against resistance. Okay. So the next thing we're gonna do is observe pupillary response bilaterally. Okay, we're gonna look into your eye and I'm going to shine a light in there and you tell me if there is a reaction, okay? So you want to close one eye. Okay, I'm gonna shine a pen light into there. Okay, and there was reaction, which is what we want. So you're gonna do the same thing with the other eye. Okay, shine your light in there. And that one did have a reaction as well. You're gonna inspect the condition of her eyelid, cornea. So pull down your lower eyelid and look up. Okay, and if you could do the same thing with your other eye. Okay. And while doing that, you can use your pen light or you can dim the light for a better look. The next thing we're gonna do is use our ophthalmoscope at a proper distance to visualize the posterior structures of the eye. Okay, so with your ophthalmoscope, you want to come within about a thumb's width of the patient's eye, and you want to take a look into the back of their eye. Okay, and you're gonna do that with both sides. Okay, the ophthalmoscope in that eye, and then the other one. The next thing we're gonna do is test auditory acuity. So you should close your eyes. And then I'm gonna whisper into each ear at a distance of 2 feet. Okay. Okay, were you able to hear me?
Mm-hmm.
Okay, and then you're gonna do the same thing with with the other side. Okay. Are you able to hear me on that side?
Mm-hmm.
Okay, the next thing you're gonna do is inspect the external ear bilaterally. You're gonna look in the front, pull the ear forward, and look behind the ears. Okay. And I don't see any open areas, any lesions. The ear appears to be clean with non-wax buildup. And the same thing on both sides. Okay. And it's negative for any abnormalities. Next thing I'm going to do is examine the internal ear with the otoscope bilaterally. Okay, so I've done that. The internal ear, they both look clean and should be able to hear out of both of them. The next thing I'm going to do is the Rennie test bilaterally with the tuning fork. Okay, so to create the sound, you're going to hold the tuning fork at its base, strike it gently to the heel of your hand, and see if the patient's able to hear it. Okay, you're going to place a tuning fork on the mastoid process. It's going to be about right here behind the ear. Okay. And then you're just going to hit that tuning fork, and the patient should hear the sound of the tuning fork. And then the patient should let you know when the sound has faded away. So, without stopping the vibration of the fork, move the fork as near to the external ear canal as possible, sweeping away any overlying hair. So, when the patient signals they can no longer hear it, the provider must listen to the fork themselves. It should be barely audible. That is considered normal conduction. The next thing I'm going to do is perform the Weber test with the tuning fork. Activate the fork, and then you're going to press the base of the fork firmly on the apex of the skull and the midline. If you can hear the fork, press the base on the middle of the forehead. You're going to ask the patient where they hear it. This patient, she stated she can hear it at the midline. Okay. I'm going to test the patency of the nasal cavity bilaterally. Instruct the patient to close one nostril off while sniffing in through the other. Okay, and if you can do the other side for me. Okay, and that would be considered a normal patency of the nasal cavity. Next thing we're going to do is inspect the mouth and throat. I'm going to inspect the lips, gums, tongue, and teeth with the help of a tongue blade and a light. Okay, so I'm going to pull the cheeks out with a tongue depressor and inspect the teeth and gums on both sides of the mouth. Okay, so you're going to take the blade, you're going to take the tongue depressor and inspect the teeth and the gums. So hers look normal, the mouth is clean, it's red, it looks moist. So that is kind of what you're looking for, just to be sure the patient's not hydrated, there's no open areas. The next thing you're going to inspect is the posterior pharynx.